name is Dr. Samantha Smith. I am a home health physical therapist that specializes in knee replacements. I first just want to mention my Facebook group. If you're not in it, please join. It is so helpful. I can help answer questions in the group. And then also we do monthly live videos in the group to answer member questions. Secondly, I do have a website available with really detailed articles written by me of really common questions. And then if you're watching this video after February 2023, I do have a course available that goes through pre-surgery all the way to 1 year post-surgery. We have exercises on there, common questions, common symptoms. Everything is covered in detail in my course. So now let's get to the topic of this video. So what is your life going to look like 1 week post-surgery? So you're probably at home. We're at day 1 through 7 post-surgery. So day 1, you're probably at home and you're probably spending a lot of time elevating in bed. So let me show you what this is going to look like. So you want to have enough pillows to elevate your legs. So a lot of people will think that laying like this is appropriate after a knee replacement, but really we need to have the leg up higher than your nose. I always tell my patients toes over nose. So if you're laying back like this is not high enough. Also, it's very important to keep your knee straight after surgery. So this is considered bent. There is a little bend in my knee. You can't really tell, but look, if I straighten out my knee, that's my leg straight. We need to elevate the foot to make sure the knee is straight. So you're going to do that with a couple pillows. Right after surgery, it's not going to be comfortable to elevate your legs super high. So maybe just one pillow at the bottom and one pillow across. And you can also use just like a regular pillow across like this. I always do the T formation. We have one vertical and one horizontal. You're going to put your leg up like this. Look how much straighter my leg is now. It's not completely straight. I need a little bit more, but this is probably going to be what I can tolerate at 1 week post-surgery. Maybe at 2-3 weeks post-surgery, I can add another pillow. So you'll do two pillows and one pillow horizontal, and then look at how straight my leg is. So this is a little bit more intense of a resting position because this is actually going to be more of a stretch for you. So you're going to lay all the way back, and now you see my toes are over my nose. That's exactly how we want it to be. Gravity is assisting us with moving fluid out of the leg. If we don't have our leg up high enough, gravity is not working. So it's very important to rest with toes over nose or foot over heart level. That's another common way to do it. And then your exercises are going to be the ones that you did in the hospital. Hopefully they showed you some exercises in the hospital. A lot of them are going to be the quad sets, where all you're doing is you're squeezing your quad muscle and pushing your knee down towards the bed. So you're here and you're squeezing. You probably aren't getting this lifting right here. I have not had a knee replacement, so this is very, easy for me. But if you had the knee replacement, you're probably more looking like this. Some people don't even get any movement after surgery. That's okay, it'll come. Your next exercise are going to be ankle pumps. Ankle pumps are really great for moving fluid out of the leg. We're doing all of these exercises hourly. These exercises shouldn't irritate you. You can also do all of these exercises when you are elevated. So you're here and like this, and you're laying down resting. You can do your ankle pumps just like this. You can do your knee squeezes, quad sets just like this. And I'm sure you have an animal that comes and hangs out with you. Very realistic setting here, right? Okay, then the next exercise is butt squeezes. Squeezing your bottom together, squeezing your butt cheeks. All of these exercises we're doing 10 to 20 times. Every hour is what I have my patients do. Another exercise that's common after surgery, but I notice it irritates a lot of people, is the heel slide. So you're laying back and you're doing heel slides like this and back down. A lot of times this is really painful. If this is really painful and you're getting sharp pains in the knee, I tell my patients, let's not do it. Let's wait a couple days. So if you're like 2-3 days post-surgery and this is really irritating, let's just wait a couple days and try it again. But if you're doing okay and you're able to bend your knee, it's not hurting too much. I start out with 10 times twice a day. We're not doing this exercise hourly quite yet. This will cause a lot of discomfort if you do it hourly, so we're just doing it 10 times twice a day. With the heel slides in particular, if you're doing them every hour and then the next day you wake up and you're like, whoa, my pain levels are through the roof now, it's probably because of that heel slide exercise. So you need to scale back a little bit, talk to your surgeon, talk to your physical therapist, ask them, hey, can I scale back on some of the exercises? I'm having more pain now. That might be the answer to kind of decrease your pain. Make sure you're taking your pain medication on time as well. The other exercise I'm having my patients do at 1 week post-surgery is walking hourly. This is so important because you're at a risk for a blood clot after surgery. The average time for a blood clot is around 14 days. That's when most of them happen. So you need to be up doing things every hour. So that's why we're doing these exercises every hour. You're probably taking a blood thinner and you're getting up and walking with your walker every hour. By day, 4, 5, 6, and 7, the bed exercises are probably getting pretty easy. So then I'll have my patients move into standing exercises. Let's demonstrate those next. So here we have the walker. We're going to work on the standing exercises. So it's going to look like this. We're going to work on just kicking out in front of you. We're doing all of these exercises 10 times, and we're only doing them on the surgical leg. We're not doing both legs with these exercises quite yet. That's because it is really challenging to put all your weight on this leg 1 week after surgery. So we're just working on the surgical leg. We're going to do 10 kicks forward, 10 kicks backwards, 10 kicks to the side. We're going to do 10 marching. Your marching is going to look like this 1 week post-surgery. You're not going to be able to lift it all the way up. We're going to do 10 kicks backwards, trying to get your heel towards your bottom. It's going to look like this. We're going to do 10 on your tippy toes and 10 mini squats. If you can tolerate this one usually is pretty irritating. So if you don't like this one, don't do it quite yet. All of the standing exercises we're going to do 2 times per day. So with my patients, if you're tolerating all those exercises pretty well, we're going to move into bending the knee a little bit by day, 5, 6, and 7. We're slowly adding in those heel slides if you can tolerate it. And then we're going to add in some just seated knee bends. So it's exactly what it sounds like. So sitting in a chair, all you're going to do is take your surgical leg and you're just going to bend it back as far as you can. And then hold it there. You're going to feel a pull in the front. It's going to feel really tight because it is swollen. We're going to hold it here about 10 seconds and then relax. We're going to do that 3 times. Hold it there. Make sure you feel a good pull in the front of the knee, 10 seconds, then relax. We're doing this 3 times. And at first, I'm having my patients do this twice a day. And then I'll come back the next day and I'll check on their symptoms. How are you doing? And did you have any increased pain? If they're feeling good, then we'll increase the intensity of this stretch. I'll say, let's hold it 15 to 20 seconds. Let's bend a little bit farther. We'll try that. And then relax. So the goal is every week we want to bend the knee a little bit further. So those are the exercises that you should be doing at 1 week post-surgery. You want to make sure you're progressing with your exercises, but you're not doing too much too soon. This is where the expertise of a physical therapist comes into play. We know what exercises to prescribe, so make sure that you're consulting with a physical therapist or you are talking to your surgeon about your exercises. So thank you guys so much for watching. Please ask me questions in the comments. Join my Facebook group. I'll see you again next time in the next video.